So there's a lot going on right now on social media, and there's kind of two concepts. Like one is content creators are jumping on the fact that you can't balance your hormones. And although they're true, it's a little bit of cherry picking. It's kind of a little bit of a marketing term to talk about, like, let's balance your hormones. So I want to unpack that a little bit, tell you more about it. The second thing is a lot of people are talking about hormone balancing is just a women's issue. And there's really a lot of factors to it. So just to kind of jump into the endocrine system and how it works. So with men, there's a 24-hour hormone cycle. Basically, your testosterone's pulsating throughout the day, different times. There's a lot of nuance. There's a lot of different things in your blood work that do affect overall your testosterone levels throughout the day, sleep, nutrition, hydration, a lot of different things that can impact that. So you can't really balance it. It's more about finding optimal function. And specifically for men, we want to look at ratios in different markers and how that affects the patient. Another example is like symptomology, how they feel. So it's really important you're working with somebody who's going to follow patterns of how you're feeling, what are your symptoms at different levels, and routine blood work as well to stay on top of how your body's feeling. So it's one thing to have the blood work, it's another thing to have the biofeedback or the feedback from the patient themselves, but that's really important to monitor. So there's a lot of nuance to that, but at the end of the day, it's not balancing, it's just trying to find optimal function. When we talk about women, what's really different with women is they have the same 24-hour cycle as we do. So there's different cortisol levels, there's testosterone that women have as well, and then you layer in about a 28-day menstrual cycle. So they have their progesterone and estrogen that's rotating throughout those 28 days. So although it's not just a women's issue to balance hormones, it is more complex, and it's very important that you're working with a physician or a practitioner that can do more advanced diagnostics. They understand the differences in the endocrine system, because women are not little men, and that's often something that you may see in treatment guidelines or something when someone's trying to look at how their hormones are working. But at the end of the day, again, the focus here is optimal hormone function, not necessarily we're trying to balance the hormones, because they don't really balance. They're changing all throughout the day, throughout the week, throughout the time of the month, and so on and so forth.